Hello, and welcome to TEPI's Infection Prevention 303, titled Infection Prevention and Control Training. Today, we are going to talk about infection prevention and control training and provide a brief overview of what training is needed for infection preventionists, what training for infection control practices should be given and taught to nurses, clinicians, and other ancillary staff. And this is a joint presentation from TEPI, the Texas Epidemic Public Health Institute, and the P2R Consortium. If you're new here, the presentation will be recorded and posted on the TEPI YouTube page approximately within a week, along with an email sent with the slide deck to participants. So again, today's lecture will be recorded, posted on the YouTube channel, and within approximately a week or so, given access to the slides. We will present the material, then go into a learning activity, and then open up the discussion for any questions that the participants have. I ask you all to mute yourselves and keep all questions towards the end of the presentation. So before we begin, just a little background. My name is Dr. Kayla Rush, and I am an infection preventionist who has been certified in infection control, public health, and healthcare accreditation. I also have my PhD in epidemiology, which all focuses on training and orientation practices for infection preventionists. And I work for TEPI, which is the Texas Epidemic Public Health Institute, which its goal is to keep Texas safe and the economy strong by strengthening the capacity and resiliency of the Texas communities to help respond to future infectious disease outbreak. At the end of the presentation, there will be some more QR codes that we invite you to come to learn more about TEPI, the other different cores that we have at TEPI, and along with connect with us on social media on LinkedIn, Instagram, and other platforms as well. So today's learning objectives are that we are going to describe and discuss infection control trainings for infection preventionists, or IP. We're going to describe and discuss infection control trainings for nurses and clinicians. And lastly, discuss and describe infection control training education for. So let's begin with first talking about infection prevention and control training for infection preventionists, or IPs. So who are IPs? IPs, or infection preventionists, are especially trained professionals. They are leaders, they are educators, they're collaborators, and they come from a very diverse background. They can have a background in nursing, public health, laboratory, or allied health fields, and they work in a variety of environments, such as healthcare systems, clinics, non-healthcare settings, industry. They work for healthcare agencies or long-term care facilities, and their goal is to really create a safe healthcare environment for both patients and healthcare providers. In these facilities or at the organizations, IPs work with many individuals, such as healthcare leaders. They work directly with healthcare departments, public health, community departments, regulatory agencies, and multiple professional agencies. So they work in a variety of settings with many different people, from your healthcare leaders, such as your C-suite or executive suite managers and supervisors, to all the healthcare departments, working with our physicians, nurses, therapists, pharmacists, and others, our local, state, and federal public health agencies, first responders, our regulatory agencies such as CMS, OSHA, Joint Commission, and others, and are members of professional organizations such as APIC, SHEA, IDSA. And what they do to really create a safe environment for healthcare staff and professionals involves a lot of things. They conduct different surveillance and reporting measures for epidemiology. They are in leadership discussion to try to improve process improvements. And they're mostly seen as subject matter experts at the organization that they're in. They help with emergency management for new and re-emerging pathogens, pandemic preparedness. They do outbreak response initiatives. They ensure a safe environment by having up-to-date standards, policies, procedures, and compliance with the regulations on environment of care. They provide a lot of education to themselves and to their whole facility at every single different level of the organization. They also talk with patients and community members too, and really partner with local public health individuals. And a lot of times their main initiatives are to really identify and reduce healthcare acquired infections, or HAIs. So that's looking at hand hygiene, looking at your medical uses device, our surgical procedures, having great antibiotic stewardship, and making sure that we have the right precautions set in place. And that really doing all those things really helps improve our quality of care in the healthcare facility. So how should infection preventionists be trained? They should be trained in these 8 core components, which should look very familiar, which is the 8 core components of the national and now starting international recognized certification from the Certification Board of Infection Control, or CBIC. And they've really put that infection preventionists should be able to identify disease processes, conduct surveillance and epidemiology investigations, prevent and control transmission of infectious agents, have a comprehensive employee and occupational health plan, regulations, recommendations, have great management and communication, education, research, environment of care, and cleaning, sterilization, disinfection, and aseptic techniques. So all 8 components goes into our certification exam, which should then, these things being done on a daily basis, that every IP, regardless of what facility that you're in, if you're in acute care, long-term, or skilled nursing home, all initiatives should go around these 8 core components to really help develop a safe environment for patients and for healthcare workers. So what does that look like? Now we're going to break it down and talk about each 8 components individually and just kind of, again, give a broad overview of what can go into that. So the first component is identifying infectious disease process. And the best way to do that is to have a strong microbiology background. If you don't know exactly what microbiology organisms in the classification you can't develop effective cleaning, disinfection, sterilization practices, education, and handling of these patients if you don't know the background of the pathogen that they're infected with. So knowing the difference between bacteria, viruses, parasites, and fungus is really critical. It also plays into your antibiotic stewardship policies and procedures. You want to make sure that you're giving the right treatment for the right type of pathogen. So giving antibiotics for bacteria, giving antivirals for viruses, antiparasitics for parasites, and antifungals for fungus. And then knowing the difference between what is considered normal floral versus pathogenic organism. As humans, we have good and bad bacteria all over our body. So knowing what is normal flora, what's supposed to be there, and how much and what strain of species in our normal flora versus something that is opportunistic or pathogenic. And then being able to identify what the mechanism of pathogenicity, which means does it cause disease or not? So will it cause a patient or an individual to become ill? And then looking at virulence factor is how severe will that illness be? And looking at factors such as your toxins, your adhesions, other characteristics within that. Do they create biofilms? What are the risks of that? Knowing all that basic microbiology background will really help you understand what's at risk, who's at risk, what is considered good bacteria, what's bad bacteria, what's opportunistic bacteria, so that you can develop your surveillance plans and your policies and procedures around that information. So with microbiology, then a great tool that we have is our diagnostic methods and laboratory testing. So making sure that you know what's at your facility, what type of testing. And a lot of our common microbiology testing that we do cultures, gram staining, PCR, in serology and antigen detections. So being able to know what cultures are needed for what specific uh, pathogens, such as viral testing versus parasitic testing versus fungal testing versus bacterial testing, and then being able to read those results and interpret them appropriately. So one of the results that we use is our MIC value, which really kind of helps to tell if something is sensitive or resistant to a certain bacteria. You always want to make sure that you are collecting cultures and then looking at the results to see if they are on the effective treatment or not. And that plays into antibiotic stewardship of making sure that they are being treated appropriately and we are not breeding resistance by giving or treating a patient with antibiotics that is not effective in treating that. So they will not be able to clear the infections because the bacterial is resistant of that certain antibiotic that they are given. We also want to look at and know and understand what the difference of sensitivity and specificity is. So that's being able to tell our true positives and our true negatives. And this is a lovely diagram that really shows how you calculate that. It's really good to understand the difference of sensitivity and specificity and when it comes into play in laboratory techniques, especially when you are in the lab or looking at results and you know what is the rate of the false positives and false negatives. So that's really something to be mindful of, especially when you are changing platforms or if you have a new vendor, a new testing platform, if you're using different materials. When you're part of those conversations and when you're discussing with lab, ask those questions. What is the difference? That will help you know kind of always what's going on in your facility, especially if you are changing testing algorithms, knowing what your current sensitivity specificity test is and this new test or this different test that you're going to based on studies, if there's a shortage in supplies and you're having to switch platforms, or if you're just updating your lab material and diagnostic tools as well. So knowing if it's a true positive or a true negative, that can help you understand your overall positivity in your area or in your organization that you're looking at. And when you're switching platform, if you know the difference between these rates, you can kind of anticipate that your number of positive and negatives might change. And if it's an outbreak, if there's something to be concerning, or because this is a new algorithm that, there isn't change in your population compared to all of a sudden that you're seeing a huge spike in positive results, you might want to maybe conduct a epidemiology investigation to see what's going on, that there's a change with these test results. Talk with your lab, talk with how people are collecting the samples, making sure that there's no error mathematically and that you are truly seeing an outbreak or a jump in positivity rates. The next thing under identifying infectious disease process is really looking at emerging and reemerging infectious diseases. So these are just some common ones that we've seen in the last couple years, from knowing what's going on with COVID, for Mpox, for SIORS, tuberculosis, and what's going on with measles. Being aware what's going on in the community can help you prepare your facility, having discussions around cohorting, staffing, PPE usage, and calculating your burn rate. Knowing what's going around in your specific area, your outlying areas, and through the state and the country is really helpful so that you can prepare and plan for these types of outbreaks or these increased isolated events too. It's also good to look at and review policies and procedures to see if any of the best practices have changes, if there's been new evidence that have come out saying that this is better than previous things. We have done more studies. This is a new testing algorithm. Actually, the isolation should be this and not that. As we saw with COVID-19, there was an evolutionary of best practices and guidelines. You always want to make sure that you are re-reviewing and just checking back to see that what your policy is reflective of what the current practice is, and making sure that you're looking up at those annually. Next is conducting surveillance and epidemiology investigations. As I mentioned, a prime focus of what infection preventionists do is conduct ways to improve and reduce healthcare associated infections, which, as I've talked in previous modules in some of the 100 and the 200 series, and earlier in the 300 series of this year's, specifically knowing your epidemiology definitions of what healthcare acquired infections are and meeting the criteria and doing the workup. So our main ones that we look at are central line associated bloodstream infections, CLABSIs. CAUTIs are catheter associated urinary tract infections. CDI is our C. diff infections, MRSA, surgical site infections or SSI, and ventilator associated pneumonia. So making sure that you're up to date with the National Healthcare Safety Manual that comes out every year. There's new updates that come to it, that you're familiar with the new updates, that you're reviewing them, and then also that you are conducting your state notifiable conditions, making sure that your surveillance covers certain pathogens in your area and that you are being compliant with the timeline of notifying. You're calling your local public health agency immediately within a couple days. You're sending a fax or electronic notifications based on your county's reporting algorithm that they use to make sure that you are being compliant with what bacteria that we should be notifying them, and then making sure that it's listed and reported accordingly. And another way to help you really keep up to date with surveillance and with identifying emerging and re-emerging is making sure that you're signed up for the healthcare alert network, or either your HON, which come out from the CDC, that lets you know what's going on throughout the country if there's isolated pockets of a certain pathogens that's presented. And touching base with your prevention team, especially with your readiness response and preparedness initiatives or emergency management within your facility, making sure that you are aligned with the policies, procedures, you have your kits, you have your supplies, you all are on the same page of what's expected. If there is an outbreak, if there is a situation, you're doing drills, you're having conversations around it, that you're all keeping up to date of what could potentially be coming into your facility and how you can prepare and react or control the outbreak by having proper policies, procedures up to date with the best practices. Then we go into preventing and controlling transmission. So knowing the chain of transmission, as I've talked previously in 101 module, if you haven't looked at that, I recommend going back and reviewing that module of looking at the chain of transmission, of looking at the relationship between infectious agent, the reservoir, the port of exit, the mode of transmission, which then ties into what type of isolation the individual needs. If they need contact isolation, extended contact droplet airborne, the port of exit, and the susceptible host. So knowing all of those components and how it relates to each other, you can develop policy, procedures, training, and education throughout your facility, so you have a standardized approach to try to break that chain of transmission and reduce exposure to other staff and patients for a specific pathogen. And as I mentioned earlier, that all goes into antibiotic stewardship, making sure that you are ordering tests, you're looking at the results, and that they're on the proper treatment. If that's an antibiotic, antifungal, antiviral, antiparasitic, and making sure that you're rounding in your areas and you're talking with your team. So that involves talking with the nurses, the physicians, and the pharmacists, making sure that they are on the right treatment for the certain pathogen that they have. So that's working with them to develop algorithms to make sure that everyone knows inappropriate antibiotic use, providing this information of what antibiotics and what type of pathogens and its resistancy when you're doing your healthcare infection workup or your HAI data, that you are discussing this not only within your department, other departments, along with your C-suite at your organization as well, and that information going into your antibiogram compliance, and then making sure that you are reporting effectively and then educating based on what you're finding and what you're seeing within your specific organization and the community that you are located in. Then we go into employee and occupational health. In some facilities, infection prevention and occupational health are in two different departments and they provide support with each other. And in some facilities, they are with one individual. If they are in two different departments, IP just goes in and supports occupational health on their recommendations. But that should also look at your vaccination immunization policies, what is recommended for healthcare workers, looking at how to stay safe in certain areas, working with certain patients and protocols, knowing what your pre and post exposure plans are, your needle stick injury, your OSHA bloodborne pathogen exposure plan is, and then your fit test screening, making sure that we have all the appropriate respiratory protection that we need to stay safe, along with our illness policies, our call out policies, and our return to work criteria. If patients, if healthcare workers are exposed to certain thing or developing certain signs and symptoms, when is it safe for them to work? What is the incubation period? What's the shedding period of that specific pathogen that they have? And when can they safely return? Is it within 3 days, 4 days? Is it 3 weeks? Based on the guidance and that specific pathogen. Another main thing that infection preventionists do is they do a lot of management and communication of best practices, which are not only put out from organizations such as the CDC, but also regulatory compliance with CMS, OSHA, FDA, and Joint Commission, along with best evidence-based practices of what we should be doing and how to stay safe in these environments. So you want to make sure that you have effective communication within your department, and then that is being disseminated throughout the facility and really reframe towards the audience that you are providing the education. The conversation on infection prevention and control will look very different based on if you're talking to patients, if you're talking to community members, if you're talking to your C-suite or executives, versus your front time staff, such as your nurses or your providers. You are developing risk assessments and policies. You're looking at what the risk of certain pathogens and certain events and how that can affect your events and what is the best way to stay safe in those, advocating for infection prevention measures, and then always addressing non-compliance very diplomatically, really reframing the conversation of, what's making sure the individual knows that what they're doing potentially could cause harm or is unsafe for them. And so making sure that you're having those conversations really diplomatically, and that you are clearly explaining the risk that can develop from a non-compliance. As we kind of have talked about, infection preventionists are the subject matter experts within the organization, which a lot of times they are responsible for disseminating this information. So you want to make sure that you have scheduled time to keep yourself up to date on the evidence-based practices, IP training and research that's going on, making sure that you have time, that you are writing up your findings, you're presenting your findings. That's either within your organization, that's at your local public health, that's at local or state or national conferences, that you are conducting quality improvement projects, you're using evidence-based guidelines, and you're developing effective training programs and education based on that. So you're knowing what's going on in your facility, how people learn, what they are needing, identifying gaps in practices, and then providing education and resources and references based on the needs of your specific facility. Another big component is environmental care, which goes into a lot of different things. Environmental care is highly regulated. There's certain regulations from CMS, or the Centers for Medicaid and Medicare, Joint Commission, or TDHC, and OSHA, making sure that we have certain policies, procedures, there's recommendations, and there's regulations from these organizations, and that your facility is following them. and you will use their recommendations and regulations into your infection control facility design of making sure your airflow, ventilation, negative pressure rooms are up to code. You have a waterborne pathogen prevention plan and identification. So you make sure that you're testing your water, you're testing your air. When your facility does construction and renovations, that you have done your risk assessment, you're monitoring, you're auditing, you're doing your ICRA, your 2.0. If you're new to infection prevention and you're not sure what the ICRA 2.0 is, I discussed it in a 200 series and a 100 series. I recommend you going back to our TEFI YouTube page to look at those lectures, and it specifically walks you through an ICRA and how to code it and what's all involved in it. Another thing that you can do is environmental sampling and monitoring. And as I've mentioned in previous lectures, there can go a lot into that. So make sure that you're having a well-rounded conversation with all leaders. Because if you do find a pathogen in your facility, which we all will find pathogens, making sure then you have the resources to act on it, and also the financial cover and cost to do environmental samples, and that you're strategically designing what areas that you're going to sample, and that you kind of have a plan. And then lastly, doing disinfection and cleaning, making sure that every piece of equipment from low level to high level is cleaned, disinfected, high level sterilized, or sterilized according to the instructions for use, or IFUs. And going into cleaning, sterilization, disinfection, aseptic, knowing your object classification of what is required for non-critical items, semi-critical, and critical, so that you are auditing them appropriately. You know what device, if it needs to be cleaned or disinfected, high-level disinfected or sterilized, and then what type of policies, procedures, and workflow that goes along. And then also looking at your environmental cleaning and making sure that you are cleaning your high touch surfaces, your rooms, with the difference between a terminal cleaning room, a daily clean, and an OR sterile cleaning area that you should be monitoring as an infection prevention, and what all goes into cleaning rooms in those categories differently. So now I'm going to switch gears and talk about infection control training for nurses and clinicians. So the top infection prevention and control training that clinicians and nurses should have are these top 11 things, and we will discuss them each in detail. So the first one is hand hygiene. No surprise there. Hand hygiene is the number one way to reduce healthcare acquired infections and permit and exposure to other patients and staff for certain pathogens that we are working with. Best ways to make sure that you are washing your hands effectively, that you know when to use water and soap versus an alcohol-based product. So that's the number one, reviewing. Not only talking about it, but watching people how they clean their hands. And then going into the second thing of knowing how nurses and physicians properly don and doff PPE as well. And this was discussed in detail in the 101 lecture of the TEPI series. So making sure that they know to first always conduct hand hygiene when you put on personal protective clothing. That's always step one, and it's also the last step after you remove your PPE, and making sure that they're following the correct steps, they're having a good seal of their mask, and they're not contaminating their PPE before they go into a procedure or a sterile area, and then they're not cross-contaminating themselves with dirty PPE when they're removing it. Knowing what the transmission-based precautions are with the signage, order set, and PPE, along with certain products that need to be cleaned for that. So knowing the difference of contact precaution, droplet precautions, and airborne precautions, what that looks like for the pressures within the room, with the disinfection products that you're using, along with your PPE. And then always reviewing respiratory hygiene and cough etiquette, especially during the flu season. We're just coming at the tail end of the respiratory season, but making sure that people know how to sneeze and cough appropriately, to reduce exposure of their pathogens to other people when they're in the workforce, and then making sure you have really good hand hygiene compliance during cold and flu season as well. So these are some great resources that really talk about covering your cough. We've seen this before. This campaign has been going on a long time, and it is shown to be best practice. Another thing that you want to go over is aseptic technique. So making sure that nurses and clinicians and providers know exactly what aseptic techniques, knows appropriate hand hygiene of how they should be doing their scrub before donning sterile PPE and going to perform an aseptic technique, what standard precautions are, what type of transmission, what the sterile field is, how to maintain sterile field, and how equipment needs to be handled and operated in this sterile field, applying and removing the sterile gloves and PPE so they don't contaminate them before going into the sterile field, and that they don't cross-contaminate themselves after they are done with the procedure, and then disposing of them appropriately, and how to dispose of infectious waste, which also ties into injection safety and sharps handling, making sure that we know how to handle our sharps so that we're not having needle sticks or sharp incidences, therefore having potential bloodborne pathogen exposure to our healthcare workers, that they're knowing where the biohazard disposal kits are for the sharp, that they're not overfilling them. The importance of not overfilling them is that if they are overfilled, sometimes the locking mechanism cannot fully engage, so it's not fully sealed, and that when then you're transporting that, some of the sharps can come out and potentially injure other individuals. So making sure that they know when to change out, do not overstuff them, how to handle them appropriately to make sure that we don't have cross contamination, then we don't have potential unsafe events for our healthcare workers because of mishandling sharps. And that ties into handling medical waste, making sure that we know what the classification of our waste, how to dispose of it, what's the difference between regular waste, biohazard waste, pathology waste, sharps, pharmaceutical, chemo, and hazardous pharmaceutical, and making sure they know what sharp bins are what and what they are designated for, so that they are not putting a chemo substance in a regular biohazard waste. It needs to be in a chemo waste, and making sure that those waste containers are around, they know what to look for, and they know where to find them if they need one, or the one is completely full and they're needing another one. So making sure that they know where all these waste bins are, how to handle them, where to store them, and how to document the transportation of them too. As I've mentioned and will continue to mention, a big part of infection prevention and control is also aligned with antimicrobial stewardship, making sure that we know what type of pathogen we have, what type of treatment, therefore, we should be giving them, looking at those culture results to make sure it's an effective treatment and they're sensitive to it and they're not resistant. If they are resistant to that bacteria, then we are switching it, maybe consulting our antibiogram of the next stage, or talking with our pharmacist and having a multi-shared decision discussion of what type of antibiotics, if they're resistant to this, should they be on this? Is there more appropriate? And then also having that discussion with them, not just to start and stop antibiotics, and not just give a couple doses here, and then also framing the conversation of how they need to then have that conversation with their patients so that we have good compliance with the antibiotics on the patient ends, and then patients know how to take their antibiotics effectively and appropriately, that they finish out their course of antibiotics, especially at discharge. If the patient's going home with antibiotics, making sure that they know when to take them, how to take them, and not just stop taking them, to really help reduce the incidence in the development of resistant pathogens. Another good thing to really teach your nurses and clinicians are the National Healthcare Safety Network, or NHSN, healthcare associated infection definitions and workups, making sure that it's communicated to them that there are specific definitions that a infection has to meet to be deemed a healthcare acquired infection, teaching them the definitions and the workups is very beneficial because it can help reduce your HAIs by knowing what to look for, what they can do to prevent them, what the definition is, and also the transparency. If they're thinking that it might meet definition, they can communicate to you that they're seeing that the infection period window is this, their symptomology is this, maybe it's then potentially a healthcare acquired infection, so that they help infection preventionists with the surveillance and the transparency of the data, knowing what it is so that they know how to track and trend it as well. And then just being transparent with your HAI data. As infection preventionists, we do a lot of HAI workup, making sure that our nurses and our clinicians know about what's going on in the facility, because it takes a team to have effective reduction measures. So making sure that they know where we are on healthcare acquired infections can really help reduce them. As I mentioned before, making sure that they are aware of your healthcare, employee health and vaccination programs, recommendations, and regulations, such as the fit testing, making sure that everyone is fit tested in your facility and that staff know that every N95 fits differently. So one brand of an N95 will not necessarily fit the same way as another brand of N95. And if you are having a shortage of PPE and you're having to switch vendors, that the staff know then they need to go back to employee health or infection prevention employee health to get fit tested for the new N95. And then also reviewing the bloodborne exposure control plan of making sure that they know if they are exposed to a certain pathogen, they've had a needle stick, a certain incident, they know who to report, the timeliness of reporting, so that we can get certain testing and treatment for those individuals. And here are some recommendations that the WHO have for healthcare workers. They can be very different from your organization. So I recommend you checking with your organization of what the exact vaccination policy is at your specific organization, to see what needs to be covered for your specific health workers. And then lastly, we go into environmental cleaning and disinfection, and that encompasses hand hygiene, proper PPE, our Spalding classification, our high touch surface cleaning. So if an area is touched frequently and needs to be cleaned more, that they're aware that it needs to be cleaning spills immediately, making sure that we have the right product for cleaning that specific pathogen or piece of equipment. We're cleaning according to the RFU, the instructions for use. You're setting up and you're always cleaning from clean to dirty, to really help prevent cross-contamination. So, and then here's just a review for them, making sure that they know all the differences between the certain items, therefore how they should be cleaned, disinfected, high-level disinfection, and sterilized, and what category the items are, so that they know how to be cleaning them effectively or disinfecting them or sending them down for processing for high-level disinfection or sterilization. And lastly, we're going to go into infection prevention controlled training for ancillary staff. So here are the top things that you should be going over with them. And I'm just going to jump down to the material that we haven't covered. So for ancillary staff, these can be our patient transporters, our environmental service workers, our secretaries, our aides, our unit administrators, our food services folks. So knowing their environment and then how to clean it is in the frequency that needs to be cleaned. If it's an outpatient area, inpatient area, making sure that high touch surfaces are cleaned more frequently and that we are using the proper component or detergent or product to clean that surface effectively, and that it's maintaining their dwell time or their wet time appropriately according to that specific product. Each product will have a list of what it is effective towards and how long it needs to maintain or be wet or your dwell time. So making sure that if you're having a product that it says it's effective for bacterial some viruses and some funguses, and then it needs to be wet for 4 minutes. That surface needs to maintain wetness for 4 minutes to adequately and effectively clean that product and remove those pathogens. And then on the inpatient area, making sure that we're cleaning routinely, knowing the difference between a routine clean and a terminal clean on the environmental service side, making sure that they are cleaning high touch surfaces, low touch floors, handrails, sinks, and making sure that they have additional guidance. They know their schedule of how they should be cleaning, so no area is missed, and that they know their cleaning schedules. And it is also very important and helpful when infection preventionists know these schedules as well too, so that you can have collaboration and alignment with the cleaning of the environment, to making sure that everyone's on the same page, that it's being cleaned appropriately, the timeliness of the clean, and the level of cleaning and being efficient. And then lastly, making sure everyone is aware of spills and how to clean up spills if they're in patient areas or non-patient areas. Is a spill is a potential fall risk, it's potential pathogen exposure to anyone that comes into that area. So everyone, regardless of title, knows how to clean up a spill, put up the signage, call a certain group, to really make sure that we don't have any accidental slips and falls in that area. And since these ancillary staff maybe might not be as familiar with working with blood pathogens compared to our nurses and our clinical providers, that every day they come into contact with pathogens and blood products, we want to make sure that we're giving them training. They know how to handle these things in case they are in that situation. There is blood, there's certain waste with blood, they come across a sharp, they know how to identify it, what to do in case they get stuck, who to call, the timeliness of that, the importance of reporting of it, and what PPE to wear if they come in contact with these products, since it's very unfamiliar to them. Since they are in the healthcare environment, they have a risk to being exposure to a bloodborne pathogen, but based on their job duty and what they exactly do, it might be very infrequently. So making sure that everyone is aware and they've had their training and they know what to do in case that happens. And then talking about another main thing that sometimes get overlooked is handling and transporting of linen. Making sure that we know how to transport clean linen, dirty linen, store them, what recommendations and regulations that go along with that. So making sure that when we have dirty linen, that we're not accidentally exposing ourselves to the certain pathogens that's on the linen. We know how to store our clean linen so that it's always clean. Linen should always be covered. It should never be open to the environment, because if it's open to the environment when people are walking by, or if it's just on a cart that's not covered, particulates in the environment can be stirred up and land on the linen. And then when they go to put the linen, or the patient use it on the bed or a hand towel, then they are exposing themselves to that pathogen on that clean linen and potentially developing an illness based on that exposure. So making sure that you have good policy, treatment, and compliance of how to handle linen, making sure that we're not putting it on the floor ever, that we're not leaving it open, that we are storing dirty linen appropriately is always really important. And then lastly, everyone knows that the linen, if it's either cleaned on site or a third party or an offsite, that there are regulations of the water, the heating, and the detergents that are being used on that linen, and that it's being cleaned up to the recommendations and regulations of actually laundering the linen as well, and making sure that you're monitoring and auditing that practice, making sure the temperature, water in the facility, or if you're using a third-party facility, that they are up to the code on how linen should be handled. Then we go into food safety. In any healthcare facility, we provide food, so we want to make sure that we're handling food safe. We know how to handle food, and we are storing food appropriate to temperature so that we don't have a food illness outbreak based on not storing or cooking foods appropriately. We're knowing what surfaces, how to cook them, how to clean those surfaces to prevent cross contamination, and that we're cleaning and sanitizing our kitchen, our utensils, and equipment according to the standards, and making sure that we are cleaning more frequently those high touched surfaces as well. And then that we are also tracking our temperatures and for any food that we are storing. So if they're in the freezer, in the fridge, or in a warming bath, we should have a log. We are tracking that it is being maintained, and that you're keeping a record of them. So we want to make sure that we are preparing, conducting, and handling food safety so we don't have a foodborne illness outbreak in your facility. And then lastly, talking about patient and staff safety and transport. So staff know how to transport patients effectively using good ergonomics. They know how to safe lifting and movement practices to make sure that they don't get hurt. They also know how to transport the patient and making sure that nothing happens to the patient. They're using infection control practices. They're disinfecting the equipment before and after transportation. They are wearing the PPE themselves. They are encouraging the patient to wear PPE if that's needed, such as if the patient has a wound, that wound should be covered. There should be no fluid on any linens. If there's dirty linens before transferring, you're providing clean linens, and then making sure that you're washing your hands. Your patient's also washing your hands, and then making sure you know what emergency protocols are in place in case any falls, incidents, or equipment malfunctions occur. So I know that was a lot of information, and now we're going to go into our quick learning check based on the information I provided before I open it up for questions. So I ask you all to scan the QR code, and we will do a quick 10-question multi-choice answer. I encourage everyone to unmute themselves or put the correct answer into the chat to help engage participant feedback. So I'll give you a few more seconds to scan the QR code before we will start. All right, question 1. The first step to developing an infection preventionist training plan is to discuss IP experiences. So discuss the experiences that IPs have had themselves before coming into your facility. Discuss and identify the areas of weakness and strengths that IPs. So maybe discussing their background. They know what area of those 8 core components that they're really strong in, weak in. Developing and implementing IP facility checklists. So those checklists are looking at what service lines in your facility, who the department leaders are, the patient flow. Should we be doing that, or D, all the above? What do you think is the best answer when you're first developing a training plan for a new IP in your facility? Yes, that's great. Yes, I see a lot of D's. That is correct. You should be doing all of these components when you're developing an IP specific training plan. 2, infection preventionist training should include the following: the CIC 8 core components, training on facility and organization service lines, compliance and knowledge of local, regional, and federal public health information, or D, all the above. So what should we include in our training? Yes, that's great. Yes. D, all the above. You should incorporate all of those things into your specific training plan. Question 3. The training concept of identifying infectious disease includes looking and understanding and providing a microbiology overview, knowing and understanding your diagnostic methods and laboratory testings, reviewing emerging and re-emerging infectious diseases, or D, all the above. Yes, that's great. I see a lot of D's. All of the above, all those things, and potentially other things should be involved in that core component. Question 4. Infection prevention and surveillance measures involve teaching the annual infection prevention control plan, the annual infection control risk assessment, the national healthcare safety criteria for healthcare acquired infections, or D, all the above. Yes, that's great. D, all the above. Question 5. Preventing and controlling transmission of infectious agents involves teaching chain of transmission, transmission precautions, antibiotic stewardship, or D, all the above. Yes, that's great. D, all the above. Question 6. All employees in facilities are required to have a bloodborne pathogen exposure plan, a respiratory fit program, healthcare personnel vaccination requirements, or D, all the above. I'm seeing a lot of D's. That's great. Yes. It is a requirement to have an OSHA bloodborne exposure plan, an OSHA fit respiratory fit program, making sure that you are fitted for your proper N95, and then also based on your organization and the recommendations of being vaccinated for certain pathogens due to high exposures in a healthcare facility for employees to have. Question 7. When it comes to food safety, what is involved? Monitoring storage, cooking food to an appropriate internal temperature, cleaning surfaces before and after precautions, or preparation, or D, all of the above. Yes, great. The correct answer is D, all of the above. Question 8. Safe patient transfer involves assessing the patient's condition, using proper body mechanics, disinfecting equipment before and after, or D, all the above. Great. Yes, that is D, all the above. Question 9. Who should receive hand hygiene education? Infection preventionists, nurses and providers, ancillary staff, or D, everyone in the healthcare environment? So, who should get hand hygiene education training? Yes, that's everyone in the healthcare environment. So, every single person that steps foot in that environment, even patients and staff members and visitors, should be taught how to clean their hands effectively. So making sure that in your organization that you have hand sanitizers, hand wash stations, there's signage, there's education, and you're promoting a culture of safety, and good hand hygiene and appliance is very, very important to both to ensure staff safety and patient safety. And then the last question, question 10. Effective infection prevention and control training protects patients, staff, everyone, no one. Yes, that's great. Everyone having proper and effective infection prevention and control training, policies, procedure, and a culture of IPC safety really affects everyone and it protects everyone. Since everyone is involved and plays a part in infection prevention and control, having good compliance really will help create that safe environment for our patients, our visitors, and for our healthcare workers. And here are the correct answers. So to wrap up today's training, we talked a lot about infection prevention and control training. There is specific infection prevention and control training that you should be giving to infection preventionists at your facility. There's certain training that should be given to nurse, clinician, and providers, and also ancillary staff. Since we all play a role in infection prevention and control practices, everyone should have some level of training, and making sure that we have good training if that's needed on a monthly basis, a quarterly basis, a semi-annual basis, or annually is really up to you, your department, your compliance, and kind of what's going on in your facility. So making sure when you are tracking and trending things, if you're having outbreaks, if you're seeing emerging pathogens, if you're seeing a change in practices, either a new service line or an increased number of certain pathogens, procedures, reviewing your infection prevention annual plan and risk assessment is really important so that therefore you can give either refreshing training, updated training. If it's a new service line, making sure that you're doing a risk assessment on the new service line and the patients and procedures that will be done in that line so that you have good infection prevention and control practices before that service line starts, really helps create a safe environment for everyone. So I invite you to connect with us. Here, as I mentioned from the beginning of the lecture, here is our QR code to our TEPI site. If you want to learn more about what the Texas Epidemic Public Health Institute, or TEPI, does in the course that encompass the organization, I invite all of you to connect with us on social media. Here is our infection prevention and control email. If you have any questions, if you're needing help with anything, feel free to reach out. We're more than happy to help wherever we can and have discussions around infection prevention and control practices and procedure. And for announcement, our next module, which is titled The Healthcare Environments, looking at specific environmental care risk assessment, short commission risk assessment under the infection prevention and control category, will be held Friday, May 2nd from 2 to 3 p.m. Central Time. Here is a QR code if you want to register for that module and all the upcoming modules. And like always, we invite and we ask you to complete the post-module survey. Providing feedback on these modules are really helpful to us to know how we are doing, what areas we can improve on, what additional topics or resources that you guys are needing. These modules are really designed to help you. So providing us feedback of what you're needing really helps us develop and making sure that these are beneficial for everyone. And as I mentioned before, the lectures are recorded. You will receive a link to the lecture with approximately a week or so from today, along with a copy of the slide deck. And if you have any other questions, we are here to help. There, at the end of the presentation, there is an additional slide that you can complete to obtain certification credits. This lecture was given 1 hour of continuing education for infection preventionists or anyone that hold a CIC or APIC certification, along if you are a certified public health professional or have a CPH as well. And now I would like to open it up for questions. And I just want to thank you everyone for attending. I hope to see you at future lectures.